All right, welcome back to the brain injury discussion. This is Jay. We're going to talk a little bit about heat stroke, and also this is one of those preventable brain injuries. And the best brain injury is one that you can prevent. Um, but then again, heat stroke can be fairly common in certain fields and professions, especially in winter and summer. Obviously, there's a lot of risk factors and stuff, but we're going to unpack that and what does this really deal with the brain? So, this is one of those injuries that might go under the radar when it comes to brain injury because we don't usually associate heat stroke with brain injury, but we're going to find out why that is the case. So let's get into this. So, body temperature regulation. So, the hypothalamus, which is a certain part of the brain controls the temperature. So it works with the ingumatory system, which is the skin, also the sweat glands, and it also coordinates with the endocrine system, which controls a lot of your adrenaline, hormones, your thyroid, and it really coordinates keeping that temperature just right. Just like a car engine, you don't want it to run too hot. So the body has to maintain what's called homeostasis, which is a scientific term for making sure that the temperature doesn't get too hot, doesn't get too cold. And the way it does it primarily is through sweat, which causes heat evaporation. There's also blood flow that goes to the periphery, which is your hands and feet. So hands, feet, that's away from the central part of the bodies. And so what the hypothalamus does in coordination with the vascular system is sends blood out to those periphery areas. And the hypothalamus will also coordinate with the endocrine system to reduce adrenaline and other hormones that would amp up or keep the body warm. So it's a metabolic response. Um, that's just a big part of the temperature regulation on a good day. So it's not necessarily just that it's the hypothalamus, but it's the hypothalamus in coordination with the endocrine system, with the ingumatory system. And that's some of the things that we need to consider, especially when we are looking at heat stroke in the context of a brain injury. So, what is heat stroke? Now, depending on a lot of different contexts, for example, most of the scientific literature I found reported it as 40 degrees Celsius or 104 Fahrenheit. Now, again, in the military, we used to transport people at 102.5 or higher because we can safely assume that they're already going to decompensate. But that was a military thing. But heat stroke is defined as this temperature, but then again, this might change depending on the literature. But I wanted to note that it can be exertional and it can also be non-exertional. Now you might be asking, well, Jay, what is a non-exertional heat stroke? I thought this was only gained by military guys doing their twice a year physical fitness test. Well, non-exertional heat stroke could be that that fever going up. It could be a different kind of illness that causes inflammation and swelling. So again, exertional, definitely the case. I would say that'd be the more common thing, but there's also non-exertional heat stroke out there. So again, fever's getting out of control. So there's also other risk factors involved. So age being a primary one. So alcohol intake, I can assure you that plays in with hydration, making sure that your body has enough fluids, and also other health conditions. So other health conditions might be kidney disease, might be heart disease, might be um, you know, low sodium, so on and so forth. There's a ton of these different conditions, too many to list, really. But when you think about it, those are some factors that are not and some that are preventable. So again, what marks heat stroke? Well, the common thing I saw was altered mental status. So obviously this is what happens when the body, there's damage in with heating of the tissue, so it's kind of like cooking, but it's noted by decompensation. What do I mean by decompensation? I mean that when the body starts to decompensate, it's starting to lose those compensatory mechanisms like sweating, like, sending blood to the periphery. You'll note that someone who has been in heat stroke will be very warm but dry to the touch. And it means that they've stopped sweating, so they can't really keep that heat off, or that maybe they've exhausted that. So, again, heat stroke is a very serious thing, and it's also very preventable. And again, these are, if we look at it, this is what happens when the body's radiator system doesn't work or cannot keep up with the demand. So those are things that, just kind of come to mind when we really think about what heat stroke is. So how does heat stroke affect the brain? Well, post heat stroke, and again, this varies depending on a number of different circumstances, uh, especially in severe situations, we'll find there will be damage to the hippocampus, which is this structure right here. It enwraps a lot of the deep brain structures, including the thalamus, corpus callosum, and so on. So we can see that can become damaged from an internal heat stroke where the body can't cool itself off, and just like an engine in a car that can't cool off, or maybe it's been, maybe there's not enough radiator fluid. Um, there will be damage to some of the structures because the body's not designed to withstand a temperature of 104 or greater. Same thing with certain car engines are not designed to withstand certain temperatures. So we'll see that. We'll also see damage to the midbrain, which is right over here. And we'll also see damage to the thalamus, which is another crucial part of the endocrine and the brain structure systems. All of these definitely play a big role in body regulation. So, and as one can tell by other talks, again, severe situations, but the longer usually means the more damage that is done. So, those are the kind of things that I think about as a brain injury case manager of if this was a heat stroke, well, what's to say that there's something else going on other than just that they had a heat stroke incident where they had to be cooled off. And so again, we're talking deep structures in the brain, but we're also talking about damage on a cellular level as well. So it's not just a specific structure thing, it's just the whole thing is overheating. And so, what do we see post heat stroke, especially a severe heat stroke? Well, we see that it can affect someone's attention ability. So they might not be able to make it through a 30-minute class. Might affect their memory. They might not remember as much. Of course, they might not have memory of the incident, but they might also have memory problems maintaining that short-term memory. Maybe they have a little bit of a deficit in the information processing. So they might teach class and maybe, a day later they might need to go back to it. But generally we're seeing cognitive loss in that. So a lot of that kind of pertains to like just the damage that was done by overheating. And the same thing goes with a car, right? It's not going to run the same after it's overheated. Like a car, the engine in the car is made up of a bunch of different parts. Same thing with the brain, same thing with the rest of the body. And what heat stroke does is it overheats those parts and sometimes causes a lot of cellular damage. And so that can definitely have a very negative effect on the brain. So what can we do about heat stroke? Now, again, I'm all about prevention. I'm all about mitigation. Um, I don't want people to get a brain injury. I want people to prevent brain injuries. And so, what can we do about prevention? Well, we can start off by good hydration. So, obviously, you want to keep hydrated, you want to get your electrolytes up. There's a bunch of other preventative factors out there. For example, limiting the time that you're out in the sun. If you are at risk of getting a heat stroke, if you are, say you're elderly, maybe you've had some alcohol, maybe you might want to avoid those kind of situations because unless someone else is around, who's going to help you? So obviously, maybe set a timer if you're working out in the garden. Maybe you're a little experienced in the years. Set a timer. Make sure you're not overdoing it. Those are some of the preventative factors. And again, hydration is probably one of the key points of it. But also look at those lifestyle habits. For example, the alcohol intake. Other bad habits. So if you're going to be outside a lot of the time, you might want to reduce your alcohol, your nicotine, your caffeine intake, and you might want to up that water intake a little bit. But then again, I'm not going, I'll say this before you have a lot of serious medical questions, consult your primary care provider. But hydration is a big one. And so what can we do when it comes to someone who appears to be having heat stroke? Maybe they've lost consciousness. Maybe they've had, maybe they're acting a little funny. Um, we can start cooling them and we can move them from the heat source, from a heat source to a cool spot. So getting them out of that bad position in the first place. So if they're laying out in the sun and you find them, they're unconscious, let's move them into the cool spot. Let's move them into a place where maybe we can start shedding a couple of layers for them. Of course, wearing appropriate clothing would be a preventative factor. But if they're not wearing appropriate clothing, obviously that might be an inhibiting factor. So that's something to think about. But yes, we want to cool off the body, and you'll note that you want to fan the body, put ice packs, spray the body with some water. You're basically creating that artificial sweating process. And the idea is to cool down the body. So, and you'll see that they want to, this graphic in specific wants to put ice packs like the neck, that's near the carotid artery, armpits near the brachial artery, the groin area, so that's near the femoral artery, and of course you want to elevate the feet to help treat for shock. But you'll notice with these, those are areas where there's, the big vessels are actually close to the surface, so you can help cool down the blood that way too. So these are just some simple steps that you can take as a bystander to help cool someone off if they're having a heat stroke. And again, prevention is worth its weight in gold. So prevention will always be better than mitigation. But obviously, we want to stay hydrated. We want to prevent this from happening in the first place. But if it does, you might want to know what to do. Move them to a cool spot, get them cooled down, start creating that artificial sweat process. Maybe take off those extra layers, maybe, spritz them with some water, maybe get a fan on them. You want to start cooling them down. And so, what does this lead me to conclude? Well, heat stroke can, in fact, cause a brain injury. Just like with car engines, too much heat is a bad thing. And so it can cause that brain injury, but it can also have lasting effects. And we're talking about a lot of those deep tissue critical structures as well, not just the brain itself, but we're also talking the rest of the body and how it interacts with the rest of the body. And we also know that this is really preventable in a lot of cases. Obviously, there's a lot of preventable or mitigating factors. So you could drink some more water, cut back your alcohol, cut back your nicotine, cut back your caffeine, have a good diet, wear appropriate clothing, et cetera, et cetera. And this is one of those where a bystander can do something, get them out of the heat, get them out of that heat source, put them in the shade, get them inside air conditioning, start cooling them off. And again, this is something where anyone could probably do that and do it safely. This isn't anything super crazy either. So, with that being said, I think this is one of those brain injuries that thankfully is not very common, but it's one of those where it can be prevented. And when we talk about prevention, I want to prevent brain injuries. But then again, I'm the guy who talks about brain injuries. So when we look at it as a whole, this is something where anybody can be prepared and help prevent not only their brain injury, but also help mitigate others. But anyways, with that being said, sources will always, like always, be in the description. We'd love to hear your comments about this. Maybe you've had a story about heat stroke you want to say, or maybe you've, experienced maybe a heat injury, or maybe you have a question. We'd love to hear it. And also, if you'd like, we'd like you to subscribe, and we'd also like you to like and comment on this video. We like to put out content. We like talking about brain injuries. But anyways, those are the sources. They'll be in the description below. I hope you have a wonderful day.